Welcome to MIHIRAA'S English Listening Test for Healthcare Professionals. Sample Test 4. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a dermatologist talking to a patient called MIHIRAA. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, MIHIRAA. Please come in and have a seat.
Good morning, Dr. Patel. Thank you for seeing me today.
Of course. So, what brings you in today?
Well, I've been having some trouble with my skin lately. It started about a month ago with a few itchy patches on my forearms, but it's gotten progressively worse.
I see. Can you describe your observations in more detail?
Sure. They're red and raised, and they feel really dry and scaly. Sometimes they even weep a clear fluid. It's quite uncomfortable, especially at night when I try to sleep.
Have you tried anything to treat them so far? I've been using an over-the-counter moisturizer, but it doesn't seem to be helping much. I also tried applying some calamine lotion, but that just made the itching worse. I understand, MIHIRAA. Have you had any similar skin problems in the past? Not really. I do get occasional eczema flare-ups, but they're usually on my hands and they don't look like this. MIHIRAA, are there any other medical conditions you have or medications you're currently taking?
I have well-controlled asthma and I take an inhaler twice a day. I also have high cholesterol, but I manage it with diet and exercise.
Okay. Do you work with anything that could irritate your skin? Or MIHIRAA, are you involved in any activities that could exacerbate the problem?
I'm a carpenter, so I'm constantly working with wood and sawdust. I also like gardening in my free time.
And do you have any known allergies?
I'm allergic to shellfish, but that's about it.
Thanks, MIHIRAA. This information is very helpful. The morphology of the lesion suggests it could be a couple of different things. To obtain a more definitive diagnosis, a test is conducted involving the application of small amounts of various potential allergens to your skin. The skin is then monitored for any reactions, and this procedure is commonly referred to as a patch test.
Oh, I see. Is that a long process? I've never had one before.
MIHIRAA, it's a simple procedure. It takes about 48 hours for the reactions to develop, so you'll need to come back for a follow-up appointment. But it's the most accurate way to pinpoint the cause of your condition and determine the best treatment course.
Okay, that sounds fair. I'm willing to do whatever it takes to get this under control.
Excellent. MIHIRAA, in the meantime, I can prescribe you a topical corticosteroid cream to help reduce the inflammation and itching. I can schedule the test for next week if that works for you.
Yes, that works perfectly.
I'd also recommend avoiding any triggers you identified, like sawdust and potential irritants in your garden.
Okay, I'll definitely do that. Thank you so much, Dr. Patel. I feel a lot better knowing we have a plan to figure this out.
You're welcome, MIHIRAA. I'll see you next week for the procedure, and we'll discuss your treatment options further then.
Extract 2. Questions 13 to 24. You hear a sleep psychologist talking to a patient called MIHIRAA. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Welcome back, MIHIRAA. It's good to see you again. How have you been feeling since our last session?
Thanks, Dr. Lee. I'd say things are a mixed bag. The relaxation techniques definitely helped, especially the deep breathing exercises. I'm falling asleep faster, but I'm still waking up several times during the night, and that disrupts my sleep cycle completely.
I see. MIHIRAA, can you describe the nature of these awakenings? Are they related to any specific dreams or anxieties?
Not really. Sometimes it's just a feeling of restlessness, like my mind won't shut down. Other times I'm jolted awake by a sudden urge to use the bathroom.
Interesting. Have you made any changes to your sleep hygiene routine based on our previous discussion?
Yes, I've been sticking to a regular sleep schedule. I set a regular sleep schedule, avoid caffeine and alcohol before bed, and practice relaxation techniques. But my mind just won't seem to switch off.
That's commendable, MIHIRAA. Your commitment to the treatment plan is crucial. Now, you mentioned bathroom issues. Do you have any pre-existing medical conditions that might be contributing to this?
Well, I do have a history of high blood pressure, but it's under control with medication. And I recently had a prostate exam that came back clear.
Okay, that's good to know. MIHIRAA, are there any other current problems you're experiencing apart from the sleep issues that might be affecting your overall well-being?
Not really. Just the usual work stress and juggling family life. I guess I'm just feeling a bit burnt out lately.
I understand, MIHIRAA. Chronic sleep deprivation can certainly exacerbate stress and fatigue. To get a clearer picture of what's happening during your sleep, I recommend scheduling a polysomnography test. It's an overnight sleep study that monitors your brain waves, breathing, and other physiological functions while you sleep.
A sleep study? Is that necessary?
It could be very helpful, MIHIRAA. The data from the recommended test can help us identify any underlying sleep disorders like sleep apnea or nocturnal leg movements, which might be contributing to your awakenings and affecting your overall health.
I see. Okay, I'm open to anything that might help me get a good night's sleep again.
Excellent, MIHIRAA. I'll get you scheduled for the sleep study as soon as possible. In the meantime, keep up with your current sleep hygiene routine, and should you encounter any novel symptoms or alterations in your sleep patterns, please let me know of the developments.
Thanks, Dr. Lee. I really appreciate your support.
Rest assured, MIHIRAA, we are committed to restoring your peaceful nights of sleep swiftly. We aim to guide you back to restful nights in no time. Keep in mind that the crucial elements in this process are consistency and patience.
That is the end of Part A. Now, look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now, look at question 25. Question 25. You hear a physiotherapist talking to an IT consultant regarding nerve irritation. Now read the question.
MIHIRAA, ever felt that pins and needles sensation creeping up your arm after hours at the keyboard? That, my friends, is likely nerve irritation, a common consequence of repetitive work tasks. MIHIRAA, think of nerves as delicate wires sending messages between your brain and body. Repetitive motions can pinch, rub, or compress these wires, causing tingling, numbness, or even weakness. But fear not, desk warriors. With simple tweaks, you can untangle those nerves and reclaim your workday comfort. MIHIRAA, firstly, listen to your body. Take frequent breaks to stretch and move, even if it's just a quick wrist rotation or shoulder roll. Secondly, adjust your workstation. Make sure your monitor's at eye level, your keyboard and mouse are within reach, and your chair supports your lower back. Lastly, vary your tasks. Mix up typing with filing, phone calls with brainstorming, give your nerves a break from the same old rhythm. Remember, MIHIRAA, prevention is key. By making these small changes, you can keep your nerves happy and your workdays humming.
Question 26. You hear an ENT talking to a young patient about earbuds. Now read the question.
Hey MIHIRAA, ever wondered why we have this amazing gooey stuff called earwax? It might seem gross, but it's actually a superhero in disguise. It traps dust, dirt, and even tiny bugs before they can give your ears trouble. But sometimes, even superheroes need a little backup. That's where ear cleaning comes in. Now, MIHIRAA, I know some folks like to use earbuds for this, but let me tell you a secret. They're not the best partners for your ears. Think of your ear canal as a delicate tunnel, and earbuds are like clunky bulldozers trying to navigate it. They can actually push wax deeper, causing blockages and even pain. Plus, those little nooks and crannies on earbuds are perfect hiding spots for bacteria, which can lead to nasty infections. So, what's the best way to clean your ears, you ask? Well, for most folks, gentle wiping with a soft washcloth and warm water is all you need. And remember, never stick anything smaller than your elbow in your ear, not even cotton swabs. Those guys can damage your eardrum, which is like the VIP section of your inner ear, not a place for uninvited guests. MIHIRAA, if you're having trouble with stubborn wax, that's where your friendly neighborhood ENT doctor comes in. We have special tools and techniques to safely remove wax without any superhero-sized mishaps. Remember, MIHIRAA, your ears are delicate instruments, so treat them with care. And next time you're tempted to use an earbud for cleaning, just hum this little tune: earwax is my friend, earbuds are not, keep my ears happy, that's the plot.
Question 27. You hear a conversation between two nurses about a patient's change in pain dosage. Now read the question.
All right, MIHIRAA, let's talk to Mr. Jones. Pain's been a real bear the past few hours. We upped his oxycodone to 10 milligrams as per Dr. Lee's orders, but it barely touched the edge. He's still wincing with every breath, poor guy.
That's odd. 10 milligrams should have put a dent in that fractured rib pain. Did you check for any other causes? Maybe a new pressure ulcer or something.
MIHIRAA, skin's clean, vitals are stable, no signs of infection. He just keeps saying the pain feels different somehow. Sharper, he calls it.
Interesting. Maybe a nerve block could be worth exploring? Dr. Lee mentioned considering it if the oxycodone wasn't effective.
Yeah, I thought about that too, MIHIRAA. But his BP dipped a bit earlier, so I hesitated to push anything else without you here.
Right call. Let's get him assessed first thing in the morning. Meanwhile, maybe try alternating with some Ketorolac for the sharper edge. It might hit the nerve component better.
Good thinking. I'll get that ordered before I head out. Thanks, MIHIRAA. You're a lifesaver.
Anytime, Sarah. Just another day in the pain management rodeo, right?
Question 28. You hear a conversation between a nurse and a doctor about a patient's discharge. Now read the question.
Dr. Evans. I'm worried about Mrs. Georgina, she blurted out. She seems down. Refuses to eat, barely sleeps, doesn't even pick up her knitting anymore.
MIHIRAA, I know her vitals are fine, medication adherence is spot on, but the chart paints a bleak picture. Her MOCA score suggests mild cognitive decline and the Beck depression inventory.
Grim. Discharge feels premature, don't you think? Her home support is shaky at best. That distant niece won't even return calls.
I hear you, but keeping her here without a clear medical diagnosis is unethical. Besides, this hospital isn't equipped for long-term mental health care, MIHIRAA.
But what about the fall risk? She barely sleeps, stumbles at night, and those panic attacks. Remember the one in the cafeteria?
We can schedule home safety assessments and equip her with alarms. And for the panic attacks, her antidepressant dosage could be adjusted. Look, MIHIRAA, let's try a compromise. Discharge with intensive home care, daily nurse visits, and a telepsychiatry consult every other day. We can reassess in a week.
You really think it could work?
It's a delicate balance, MIHIRAA. Mrs. Georgina needs a familiar environment, some semblance of normalcy. And with close monitoring, we can intervene if things worsen.
Question 29. You hear a presentation by a professor about robotic surgery. Now read the question.
Welcome, everyone, to the brave new world of robotic surgery at MIHIRAA'S laboratory. Today, we'll dissect this burgeoning field, exploring its marvels and, yes, its hidden stitches. Imagine this, a surgeon, miles away, manipulating robotic limbs with pixel-perfect precision at MIHIRAA'S testing center. Inside a patient, miniature cameras from MIHIRAA'S technology offer a 3D battlefield of tissues and vessels. This, my friends, is the future of surgery. But, this revolution comes at a cost, a hefty one. Millions per robot, skyrocketing healthcare expenditure. Can we truly justify such extravagance for every scalpel incision? Fear not. The ethical surgeon, the mindful engineer at MIHIRAA'S, they work tirelessly to democratize this technology. Miniaturization, open-source software, AI-powered assistance from MIHIRAA'S research division, these are the threads weaving a tapestry of affordable access. And the benefits, oh, the benefits. Minimally invasive procedures, shorter recovery times, reduced trauma. For children like this, robotic surgery is a lifeline, not a luxury at MIHIRAA'S medical center. But, a chilling question lingers: when machines wield the scalpel, where does the human touch reside? Can cold steel ever truly replicate the empathy, the intuition that defines the art of healing? This, my friends, is the crux of our journey at MIHIRAA'S laboratory. To harness the power of robots without sacrificing the soul of surgery. To write a symphony where technology and humanity dance in perfect harmony.
Question 30. You hear a morning briefing in a hospital ward. Now read the question.
All right, team, let's tackle the communication gaps that cropped up yesterday. Mrs. Thompson's case, her new medication schedule wasn't properly updated in the system. I ended up giving her the wrong dose. And Mr. Hernandez, his x-ray results got lost somewhere between radiology and his chart. We were operating blind for hours. And don't get me started on the discharge orders. Mrs. MIHIRAA was almost sent home with the wrong prescriptions. I hear you all, these lapses are unacceptable. Patient safety hinges on clear, accurate communication. But here's the thing, the fault isn't always on the system or individual forgetfulness. We need to break down these silos, folks. Nurses, doctors, specialists, we're all part of the same team. We need to talk to each other, not just at each other. These new communication boards, these daily huddles, they're not just suggestions. They're lifelines. Use them, question, clarify, double-check. Let's build bridges, not walls, with our words.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best, according to what you hear. Complete your answers as you listen. Now, look at Extract 1. Extract 1, questions 31 to 36. You hear an interview between Dr. MIHIRAA and an interviewer on her experience in treating depression. You now have 90 seconds to read questions 31 to 36.
Good afternoon, Dr. MIHIRAA. Thank you for joining us today. To start off, could you provide us with your understanding of depression and the various types you encounter in your practice?
Good afternoon. Thank you for having me here, John. Depression is a complex mental health condition characterized by persistent feelings of sadness, hopelessness, and a lack of interest in activities. In my experience, I often come across several types of depression. Major depressive disorder is one of the most common, where individuals experience severe symptoms that significantly interfere with their daily lives. Persistent depressive disorder involves long-term, chronic symptoms that may be less severe but last for an extended period. Bipolar disorder, on the other hand, involves alternating periods of depression and mania.
MIHIRAA, can you share an example of a patient who was reluctant to seek treatment for depression and how you approached the situation?
Certainly. I had a patient, let's call him John, who was highly resistant to the idea of seeking help for his depression. He believed that talking about his feelings would not make any difference. It was challenging to establish trust, but I took a gradual and empathetic approach. Instead of pushing him to open up, I focused on building a therapeutic alliance and creating a safe space for him to express himself. Eventually, he started to recognize the value of therapy and took a more active role in his treatment.
That's an interesting approach. Moving on, MIHIRAA, could you share an example of a patient with recurring depression and how you managed their ongoing treatment?
Yes, I had a patient, Sarah, who experienced recurrent episodes of depression. Each time she felt better, there was a constant fear of another relapse. We worked on developing coping strategies, identifying triggers, and creating a personalized plan for managing stress. Maintenance therapy, including regular check-ins and adjustments to treatment as needed, played a crucial role in preventing future episodes. It's essential to address the underlying factors contributing to the recurrence rather than just treating the symptoms.
It sounds like a comprehensive approach. Now, MIHIRAA, can you share an example of a patient who was fully cured of depression and has remained in contact with you even after many years?
Yes, I had a patient, Mark, who responded exceptionally well to a combination of therapy and medication. Over time, his symptoms alleviated, and he reached a point where he considered himself fully cured. Despite his recovery, he continued to stay in touch, attending occasional follow-up sessions. This long-term connection allowed us to monitor any potential signs of relapse and ensure he had ongoing support in managing life's challenges. Maintaining this extended relationship not only facilitated the observation of any subtle shifts in his mental health, but also provided a platform for Mark to discuss life transitions, stressors, or adjustments that might impact his well-being. This holistic approach, combining both immediate intervention and sustained support, has proven effective in preventing the recurrence of depressive episodes in cases like Mark's.
That's quite remarkable. Moving on to the social factors contributing to depression, MIHIRAA, could you elaborate on how external factors play a role in the development of the condition?
Social factors can indeed contribute significantly to depression. Issues such as financial stress, relationship problems, work-related challenges, and societal pressures can all play a role. It's essential to assess the broader context of a patient's life to understand the environmental factors that may be influencing their mental health. In some cases, addressing these external stressors becomes an integral part of the treatment plan to achieve lasting improvement.
MIHIRAA, considering the involvement of external factors, how do you approach incorporating the support of friends and family in the treatment process?
The involvement of dear ones is often crucial in the treatment of depression. Family and friends can provide emotional support, encouragement, and a sense of belonging. However, it's a delicate balance, as the dynamics of each relationship differ. In some cases, family therapy may be beneficial to address underlying issues within the family unit. Educating the support system about depression, fostering open communication, and involving them in the treatment plan can enhance the overall effectiveness of the therapeutic process.
Extract 2. Now look at Extract 2. Extract 2, questions 37 to 42, you hear clinical psychologist MIHIRAA talking on parenting and ADHD nexus. You now have 90 seconds to read questions 37 to 42.
Good afternoon, ladies and gentlemen. I am MIHIRAA. Today, I am honored to share with you the insights derived from my extensive research on the intricate interplay between parenting and attention deficit hyperactivity disorder, ADHD. Let's embark on this journey together as we explore the various facets of this complex relationship. Firstly, let's delve into the realm of parenting. It is a multifaceted concept that goes beyond the conventional norms of caregiving. From my perspective, parenting involves a dynamic process that encompasses not just the biological aspect but also the emotional, social, and cognitive dimensions. It's not merely about providing for physical needs, but also about nurturing the psychological well-being of the child. Shifting our focus to ADHD, a complex neurodevelopmental disorder. I view ADHD as a spectrum, acknowledging its diverse manifestations in inattention, hyperactivity, and impulsivity. This perspective guides a personalized approach to diagnosis and treatment, tailoring interventions for each individual's specific symptoms. Collaboration with parents, educators, and stakeholders is key to creating a supportive environment. In my experience, a combination of behavioral therapies, educational adjustments, and carefully monitored medication can significantly enhance daily functioning for individuals with ADHD. However, it's crucial to dispel myths, approach ADHD with sensitivity, and foster a supportive community to address the unique needs of those on the ADHD spectrum. The crux of my research lies in the meticulous sampling process. The importance of a diverse and representative sample cannot be overstated. It forms the foundation upon which the generalizability and reliability of any study rest. In my research, I employed a stratified sampling technique, ensuring a balanced representation of various demographics, socioeconomic backgrounds, and cultural nuances. This approach allows for a nuanced understanding of the relationship between parenting and ADHD, avoiding the pitfalls of a narrow sample selection. Now, let's explore the intricate web of how parenting influences ADHD. My research, grounded in ecological systems theory, examines the multifaceted layers of influence that parenting exerts on the development and manifestation of ADHD symptoms. Parenting styles, disciplinary practices, and the quality of parent-child interactions are all variables under scrutiny. Understanding the complex interplay of these factors is vital for developing targeted interventions that address specific challenges within the familial environment. By analyzing these variables, my research aims to unravel patterns and identify potential areas for intervention, contributing to the advancement of personalized strategies for families navigating the complexities of ADHD. Additionally, it underscores the importance of considering the broader ecological context in which a child develops, recognizing that parental influences extend beyond individual actions to encompass the dynamic relationships within the family system. As we navigate this complex landscape, it becomes evident that effective parenting is not a mere luxury but a crucial factor in mitigating the impact of ADHD. Teaching parenting skills emerges as an imperative component in addressing the challenges posed by ADHD. It is not just about managing the symptoms but fostering an environment that supports the child's cognitive and emotional development. Moreover, my research underscores the need for comprehensive support systems that extend beyond clinical interventions. Collaborative efforts involving schools, communities, and mental health professionals are essential for creating a holistic framework that empowers both parents and children. By promoting a multifaceted approach, we aim to equip families with the tools and resources needed to navigate the intricacies of ADHD and cultivate an environment conducive to the child's overall well-being and success. In the grand scheme of my research, the verdict is clear: there exists a profound correlation between parenting practices and ADHD outcomes. The quality of parenting significantly influences the severity and trajectory of ADHD symptoms. However, the causality is not unidirectional. ADHD symptoms can also impact parenting dynamics, creating a reciprocal relationship that demands attention. This reciprocal relationship highlights the intricate dance between parenting and ADHD, emphasizing the need for dynamic and adaptable interventions. Recognizing this bidirectional influence underscores the importance of providing support not only to parents but also to individuals with ADHD. By addressing this interplay, my research aims to contribute to the development of holistic strategies that consider both the parenting environment and the unique needs of individuals with ADHD, fostering a balanced and supportive ecosystem for optimal well-being.
That is the end of this listening test. Now check the answers.